the first version or the first webinar really dived deep into whys and understanding. I'll touch on it again a little bit. And I think the purpose of tonight is really to kind of engage all of you to test yourselves and see your own results. I will say this. I've said this in my own live courses. This is, to me, going to be our blood tests of medicine, where we really have to understand the risk factors of our patients. And in my all-day live courses, I think X-rays you're guessing, I think explorers you're guessing, and I think even a periodontal probe is, as you'll see in the first webinar, is only indicative of bone loss and pocket depths, not necessarily indicative of future disease. So I know that sounds controversial, but I back it all up with research. So thanks for joining us tonight. So we're going to start with 3 poll questions. I want to kind of gauge your interest in this. So Lisa's going to put up 3 poll questions for all of you. And these are yes or no's. So I'll let you read them. And once we're all done, Lisa will show us the results. So if you all look at this, this is quite astonishing. And I'll say it's astonishing because what I laugh about is you go on Facebook, someone shows you an X-ray and you get 8 different opinions from 2 doctors. Here, we all totally believe and understand the role of genetics. So I applaud all of you for sharing that because I believe this is the future of an initial exam and many recall exams. So let's dive into some more details tonight. So here's what the studies show. 50% of periodontal disease susceptibility or periodontitis is credited to hereditary or genetic factors. 50%. Now, obviously, I'm going to show you there are other causative agents, and the other causative issues really, as you look at this, is that when you go through a microbial challenge, and the body releases antigens and lipopolysaccharides, the host, your patients, respond by trying to create an equilibrium, and they release antibodies, PMNs, and a lot more. But when you look at number 3 here, you have environmental and acquired risk factors and genetic risk factors which modulate the host response. And so in course 1, you will see that there are so many comorbidities, which I'll touch on in a slide or 2. But then you get into the genetic risk factors. And so if someone has genetic risk factors that allow an altered immune response, we're going to see the progression of periodontal disease. And so if you know ahead of time that your patient is high risk or low risk, your prevention protocols are going to be totally different. They'll be totally different. And so we can't treat everybody as high risk and we can't treat everybody as low risk. And that's why I think it becomes fundamentally important. When we look at comorbidities with periodontal disease, everybody knows about diabetes and type 2 diabetes, which are over 150 million Americans walking into your offices. But these are other comorbidities. So you look at cardiovascular disease, rheumatoid arthritis, osteoporosis, Parkinson's, Alzheimer's, psoriasis. So when people have family histories, would you be testing these people? And then we've all learned that even sleep apnea has comorbidities of acid reflux and high blood pressure. So as I train my young associates and my young doctors, I find it so important to understand comorbidities and not just to check to see if someone's just on a blood thinner or if you're taking out a tube. Comorbidities are so important. And I think this goes hand in hand with risk factors with genetics. Genetics can really affect up to 65% of how susceptible someone is to caries. So I highlight the first one. Now, I'm not talking about geriatric caries. I'm talking early on caries. So genetics can affect the saliva, the amount, the flow, the pH, the composition, and the buffering capacity. And if you know someone's high caries risk, the next ones I'm going to show you all fall into what is genetically modified or genetically dictated by a high-risk patient. If they have a crowded dentition, they're at higher risk. If the composition of tooth enamel is more porous, that's genetically founded. How the body responds to infection, genetically induced. Your taste, and if your taste is altered, then you're going to be eating more sweets or more potentially cariogenic substances. So we have periodontal issues and genetic issues that can, we have periodontal and caries issues that we're going to talk about tonight with genetic testing. So I'm just going to run through a few of these, and then I'm going to hand it over to Suzanne. Imagine your patients coming in with a history of multiple scaling and planings, a history of periosurgeries, and they're still showing bleeding on probing in multiple areas and still continue deeper probings. Why would you not want to test them to see if they're higher risk? Would they be more compliant if they're higher risk? Are you going to see them 3 or 4 times a year? And the answer is yes. Are you going to customize your home care? Yes. Are you going to customize your own clinical therapies? And the answer is yes, if they're higher risk. Or a patient comes in with periodontal disease, a history. They're still probing more than 5 millimeter pockets in areas. They still have bleeding on probing, and they want 1 or more implants. And the studies show, again, if you don't have the periodontal issues under control, when you're restoring and placing that implant, replacing and restoring that implant, those implants are much more prone to perimucositis and periimplantitis based on the connection at the implant surface. Or a patient who's got a family history of periodontal disease, and they come in and they're a type 2 diabetic and they're having issues with their A1C. I mean, these are millions. There are almost 100 million Americans who have literally type 2 diabetes or pre-diabetes, pre-type 2. And if they're showing early periodontal disease, I think you have to keep thinking comorbidities and genetic testing. Or a patient even with just early signs of periodontal disease. They're in their 30s and 40s. And, you know, they're power brushing and flossing, but they're still breaking down. All of these, and then we get to caries. A patient comes in with multiple restorations over the last 5 years, recall visits showing really only mild plaque buildup. Home care, brushing and occasional flossing, not really diet induced. And they return each time with early carious lesions and ongoing recurrent decay. Wouldn't you want to test those? These are just a few examples of why Suzanne and I firmly believe that genetic testing can allow you far better insights into treatment planning, long-term preventative approaches, and really understanding the risks that your patients are presenting with. Suzanne is now going to take this over. So I'm going to mute myself, and Suzanne's going to walk you through the system, how you're going to onboard yourselves, how you're going to test yourselves, and really have a firm understanding of the portal system itself. And then, of course, we'll take questions at the end.
Thank you, Dr. Graham. It's very nice to meet all of you. I've had the opportunity to interact with some of you already, but extremely excited to be here to meet all of you virtually this evening. Okay, so I'm going to be doing a recap of what was shared in our first portion, and then go into more detail about the test itself and walk through how to actually test and use the portal. So first we'll talk about the science. So our test assesses an individual's risk of developing 2 of the most common conditions in oral health, and those are dental caries and periodontal disease. And our test uses human DNA, and it's very important to differentiate this, so I will emphasize it. It uses human DNA and not the saliva DNA bacterial test. So the difference here, there are tests on the market that are testing the DNA of the bacteria in your mouth. Our test is testing an individual's DNA. As a result, it doesn't matter if you're 1 year old or 99 years old, your DNA doesn't change. So this is a test that is once in a lifetime. Now, the panel development itself has 3 phases. In the first phase, we do market research, and what we're looking for are common problems that also have a very clear preventative approach to them. Then our science team gets involved, and they do an initial review of global peer-reviewed studies, and specifically, these are GWAS studies. So those are genome-wide association studies, and they are the highest level of quality when it comes to genetic research. In the second phase, they do a deep dive. So our science team goes in, looks at all of these GWAS studies, looking for genetic markers that have the strongest correlation to the condition that we're looking at. They then rank them from A, B, C, and D, and also weight them to ensure that we have identified the ones that have the highest correlation to the disease. So our test includes 25 markers for periodontal disease and 35 markers for dental caries. There are genetic tests out in the market that look at conditions, and they usually look at 1 or 2 markers. So we have significantly more than any other test on the market. In the last phase, our science team develops a polygenic risk score. So they're taking all of those markers and weighing them, and then also looking at how they interact with each other, and then compare that against the standard population, which then allows us to create that risk of low, intermediate, or high. Okay, so the genetic test kit itself. Now, some of you did order test kits so that you have them. Hopefully you have them with you right now. We're going to go through them together. If you haven't, I highly encourage you to take an opportunity with the promotion at the end so that you can get some test kits and try them yourself. Okay, so this is the kit. And I am now going to go live with you. Stop share for a second. We're going to go through the kit together. So here it is. I'm going to back up a little bit so that you can see better. So when you open up the kit, there's a few things that come inside. There is an instruction manual, and it does give you detailed step-by-steps of how to do the swab, but we're going to do that together as well. There's also a step-by-step instruction that shows you how to register. We're also going to do that together this evening. It has the swab itself packaged inside. You have the instructions specifically from the manufacturer of the swab. You have a return pouch, and then finally the prepaid return envelope that you'll be using. Okay, now the swab itself that's in your kit, this one here, is from a company called DNA Genotech, and I've specifically put a slide in here because we have carefully selected this as a swab that can be used that has the highest success rate of successfully collecting the DNA from the cheek. It is a buccal swab, so you'll be swabbing your cheek. And it also is incredibly stable because of the liquid that's inside it. So from cold temperatures up to very high temperatures, depending on the climate where you are and what time of year you're sending back in your test, you do not need to worry about anything happening to the DNA. This is a quick start guide to start with. Number 1, so that you know your office can store the test kits at room temperature. It does not need to be refrigerated. So as long as it's in maybe a bit of a higher safe space so it doesn't get knocked around, that's really all you need to worry about. Number 2, and I want to highlight this, in the instructions, it does say to advise the patient not to eat or drink 30 minutes prior to testing. However, although that is the official instruction, in our study, we were swabbing patients when they came in for their visit and also at the end of their visits, and in no way did it affect the quality and our ability to extract the DNA. In addition, it didn't matter what they were there for, whether it was a cleaning or some other procedure. In no way did the reason for visit, if we swab them after, affect our ability to successfully collect the DNA. So you don't have to worry about that with your patients. We are going to go through, we just went through what's inside the kit, how to register through the portal, how to properly swab, and then returning and how to get the results. Okay, now when you go to register, you're going to register a clinic profile first. If you're doing it with me this evening, or if you're going to be doing it, if you have a kit after we finish this evening, you will need 2 email addresses. One email address you're going to use for your clinic profile. It doesn't actually have to be your clinic email address, although officially, when you decide to use our product in your clinic, you'll want to set up one that says info@ or whatever your main clinic email address is. But for your individual purposes, choose one email address you have access to for your clinic profile, and then another email address that you'll be using as yourself as the patient. When you go to the website, and it's myaigenetics.ca, and I will show you that, there are 2 options at the bottom. So you're going to start by choosing clinic registration. You'll then fill in your clinic's name, address, the email address you've chosen, and a password, and then register. It's very quick and easy to register your clinic. That is then going to, and it can take up to 5 minutes or so to receive the verification email. You'll receive that to the email address that you provided, and you'll verify the email that you wanted this profile. And then you'll be able to log in as a clinic. And this is what the clinic dashboard looks like. So you have clinic profile information. There's a section here for reports. Now, these are reports. Once you have a lot of patients, you can start running some really fun reports on all of your patients. There's add a new patient, there's view, and then results. And I'll talk about a little bit later the difference between those 2. Okay, so live demo of clinic profile creation. So as I mentioned, you're going to go to myaigenetics.ca, and this is what will come up. And you're going to choose clinic registration. And then here you'll type in the clinic's information. So will be Suzanne's clinic, and I'll put my name. You'll just fill in this information. Go through it quickly. Choose an email address and password. Enter the CAPTCHA and hit register. Now, because it can take up to 5 minutes for that verification email to show up, I have previously registered myself so that I can quickly show you the next step. So right here, this is the first email you'll receive when you register, and you'll just click on it, and then it'll ask you to log in. So I'll show you what that looks like. So I created my clinic email address of Oral Risk C. And I'll log in. And then there I am with my dashboard. Okay, now adding a patient. Once you've created your clinic profile, you can start adding patients into the clinic. So again, if you're swabbing yourself, once you've created the clinic profile, you can now add yourself as a patient. So here's the dashboard again, and this is the section here for add a new patient. So you'll click on that. And the first thing that comes up is the consent form. As a doctor, you can consent for your patient. It does come up with view consent, the privacy notice, and the terms of service. They are here. If you'd like to, you can print a copy and keep it at your office for your patients to review. When the patient logs into their profile, though, that you create, they will also have access to all of these as well. So you'll just click I agree. And then you'll fill in the patient information. So basic demographic information. When the patient receives their email and they go to log in, it will encourage them to fill out additional information about themselves. But from our research, we've worked with a lot of dentists up to this point for this portal and our product. We understand that speed is very important. Chair time is very important. So this process for registering a patient is very quick and easy. So demographic information, you're going to enter an email address for them and a password. And you can create the password for them. They can change it later to something that they would like personally. And then the last part here is you're going to enter their barcode. So I'm actually going to just stop share for one moment. So this swab here, there is a barcode. flip it over. I don't know how well you can see this, but there's a barcode there, and directly under the barcode is a number. It starts with the number 4. That is the barcode number that you're going to enter into this section here. Now we do have a fail-safe, so if you enter the barcode information incorrectly, it must match exactly to the barcode that we have scanned in our system. So it will not let you go forward, making sure that you've entered the barcode correctly. As soon as this swab is sent back, there's no longer a name attached to it. So this is the only place where the name and this swab are attached together. You also, by the way, if you have a scanner in your office, you can also scan the barcode. You do not have to enter it manually. And then you'll get this wonderful page here that says that you have successfully registered the patient. Now, once you've done that, the patient will receive this email saying that there has been an account set up for them. If they've been signed up by mistake, again, we have fail-safes because this is genetic information and they did not want it. As long as they don't click the login now and log in, then the account will not be officially registered. Otherwise, they're going to click that and log in, and then they can see their dashboard. So the patient dashboard just has their profile and their products, so the test results for them. Okay, so now I will do the live demo from the patient perspective and the clinic adding it in. So now I'm logged in here as the clinic, so I'm going to go to add a patient. And I'm going to agree to the consent form. And then again, I'll fill in, make myself the patient. I will do date of birth. And I will be generous to myself. And address. Okay, and then again, I'll choose a separate email address for patient credentials. And I will show you now what it looks like, because I did also pre-register myself as a patient. So here we go. This is what it looks like as a patient when I receive this email. So I'll log in over here as the patient that I created. And you can see here is my dashboard as the patient. So it's a very quick and easy process to use. Now, the part that I explained, these are the instructions that do come in the kit that walk you through step by step everything that I just showed you. But we have highlighted in bright yellow on here for the patient to understand that they must click the verify now so that we have confirmed that the patient did want the test. Okay, so the testing process itself. You start by registering yourself in the portal. If you want to do the swabbing with me during this presentation, that's fine. You can register after, but do not send in, I think I've said that twice now, you may hear it from me one more time, do not send in your swab until you have officially registered. So these are the swab instructions. They do come in your kit and we will do them also together. All right. So let me just stop sharing for a second. Okay, so here's the swab. It comes in this package here. You're just going to break apart the top, open it up, and access the swab. Now, please open it. I'm just going to move back again a little bit. Open it up far enough that you're able to pick up the swab without touching the top part. So you want to keep that top part sterile. You're going to use the swab as it is. And you're going to swab your cheek 10 times on each side. You don't have to be too hard, but you want to apply some pressure because you are trying to get actual cheek cells off of your cheeks. You're going to do 10 times on one side. 10, and then you'll do the exact same thing on the other side 10 times. I don't have to do it 10 times on this side, but you're going to do 10 and 10. When you finish doing 10 times on each side, you then just twist the top off of this, turn the swab over and put it into the vial and then twist it tight. There is a liquid here in the bottom. For those of you that have one, you'll be able to see there's a bluey, purpley color liquid at the bottom. That is the stabilizing fluid. You're going to shake this. The instructions say vigorously, so don't be afraid. You're going to shake it 10 to 15 times. And the purpose of why we're shaking it is we want to ensure that entire bottom of the swab is completely saturated with the stabilizing fluid. So you're just going to shake it 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay. Perfect. Now you are ready to return this to our laboratories. In the kit is this plastic package. So you're going to take this and just place it inside the plastic package. And then there's a little piece of tape here that you can remove and have it not stick to you. And then you're just going to seal it. And now it's ready to go. You'll put it inside the prepaid return envelope. Now this envelope, we use Purelator. We are a Canadian company, fully Canadian. So we do use Purelator, which I understand is not the most common in the US. I believe FedEx is probably one of the most common. However, I have personally Googled where there are Purelators throughout the US and they are everywhere. So you can drop this off to any Purelator drop-off box. When you are doing this as a clinic, you may want to wait to collect a few at a time before you do a drop-off. Or Purelator does allow you to create an account with them. For those of you who are using our test frequently, you can create a Purelator account and they will come and pick this up whenever you have kits that are ready to be picked up. So that's another option for you. So the sample, as discussed, is placed back into the prepaid package and is sent back into us. Now, where is it being sent to? Our laboratory is the Clinical Genomics Center at Mount Sinai Hospital in downtown Toronto. Mount Sinai Hospital is a highly acclaimed, renowned teaching hospital in Toronto. It is one of the best in Canada. So we have chosen to use their laboratory for our genetic analysis and results, the exciting part. So when the results are ready at the laboratory, after they finish the analysis, they upload the results into the portal, and that then is the place where the barcode and your personal information reattach themselves again. And you will be sent as a clinic an email letting you know that the patient's results are ready and in the system, and the patient will also be notified that their results are ready, and it looks like this. When the results are ready, you go in as a clinic back to your dashboard, but this time you're not going to add a patient, you're going to go to view. Now there are two buttons here, there's view and there's results. Results, you will use that button when you have, say, hundreds of patients that you have swabbed and you want to look up one specific one. But for now, choosing the view will just bring up your patient list and it'll be easy to find the patient you're looking for. So here's an example under view. There are 4 patients that this clinic has swabbed, so you can see them here. What you're going to do is find the patient that you're looking for, obviously, because for security, I have taken out the names, but you're going to find the patient's name that you're looking for, and you're going to click on details. When you click on details, it will bring up the patient's demographics that you have entered. And at any time, because you have these patients signed up under your clinic profile, if you need to make any changes to their demographic information, if the patient has forgotten their password, you have access here to go in and make any changes if necessary. So when you get to this section, you're just going to click on Next. And it will take you to this page here. And on this page, you will see a green button that says View, and that is where you'll be able to see the patient's results. And this is what it looks like. So when you click on View, it will bring up the patient's results. It's a 3-page document. The first page will show a graph here. and it runs from low risk to intermediate risk to high risk. It will clearly identify where your patient sits in against the standard population. And then I will show you in the live version, but the other pages go through other information as well. So let's go back to the email. So this is the clinic email. So here you can see that when the results are ready, you will receive an email letting you know that they're in and who they are for. And again, the patient, I'll go back to their inbox, same thing, they'll receive an email saying that their results are ready. So we'll start with the clinic. When you click on this, it will have you log in so that you can see the results. So let's do that together. So we are going to go back to, you know what, let's just log in again so you can see the whole process. Now you'll see here I am doing dev. I'm in our demo site so that I can't make any mistakes inside our actual live site. Okay, so we're going to go to view. And there I am as a patient. I'll click on details. And we have my demographic information. And then I will click next. And there we have that it's ready. Click on view. And here's the test. So I, as a patient, Suzanne, in this demo, I have an intermediate risk for periodontal disease, but high risk for cavities. So this goes through how this is assessed. So being high risk, I'm higher risk than 75% of the population. And then the second page of the report shows you an explanation of the results and what they specifically mean, as well as possible next steps. And then it goes into a little bit of detail about the test methodology, test limitations, and we've also shared a lot of our references of how our science team put this together. Now I'll show you over here from the patient's perspective. So here the patient will receive the same thing. They'll be encouraged to log in. So I will go over here and I'm the patient. Let's see if this is still active. Okay, so I'm going to click on, no. So for safety reasons, for security reasons, this system will only allow you to stay logged in for a short period of time. So I will log back in as the patient. Okay, so I'm in here as the patient, Suzanne. I will go to my products. And again, I can view my results. Okay, so that is a summary of how to use the test, how to create the portal, again, the science of it, and I look forward to any questions that you may have, and I hopefully look forward to interacting with all of you as you decide to try our test. And with that, I am going to go back here and continue with Lou. Dr. Graham, thank you.
Suzanne, great job. Nothing more challenging than doing a hands-on webinar. So when you think about the benefits to the patient, I really feel that once they understand their own risk for oral disease and the need potentially to customize a more preventative approach, both at home and with the dentist itself, it is really important. So if you look at where we're going in dentistry, you get sleep tests after a dentist does an examination, and then they'll send you home and get a sleep test or provide you a sleep test. And you want to know your risk factors for sleep. Here, we're really trying to understand the genetic risk factors obviously for perio, and obviously for caries. Now, when you think about it from, Suzanne, if you'd advanced one more slide, what about for the dentist? And I've already seen this in the chat. And you understand the patient's own risk for oral disease and how best it is to customize a more preventative approach, both at home and obviously with your office. So when you're there working on a patient, and let's just say they come back with high-risk periodontal disease. If they come back high-risk periodontal disease and they're in your chair, and routinely now you've been doing scaling and planings or perio maintenances or whatever you've been doing, and they're still coming back with bleeding on probing, how do you want to up your game? And whether it's guided biofilm therapy, laser therapy, but really then what goes on at home and how do we maintain their biofilm at home? And the same goes with caries. And there's so many amazing products out there that can really enable a dentist to provide more options for a patient. So for example, if someone's low caries risk, they don't have to spend a lot of money on a toothpaste, for example, that is a traditional stannous fluoride. But on the other hand, if they come back high risk for caries, there are toothpastes that can alter pH, alter really the plaque adhesion to a tooth. And you have those options. You now have power flossers versus manual flossers. So I think when you start looking at those approaches, and then obviously you add a Perio Protect or other oral rinses that you want to provide patients, all of these things add up to customizing your outcomes for your patients. But knowing risk factors, I think, is paramount. So now, Suzanne, do you want to click to the next slide, and then we'll handle more questions? So let's open it up to questions, and this will dive a little bit deeper. So, Suzanne, the first question comes from Tonia about privacy concerns for the patient, since you're actually using DNA. So do you want to talk about that first?
Sure, absolutely. So great question. The privacy for the patient, because there is no identifying information whatsoever associated with the swab itself, with the exception of inside the portal, which is only accessible to the doctor who registered the patient and the patient themselves. We have covered all bases as far as privacy. When it comes to what we are testing, just to make this part very clear, I think it's important. We are only looking at the markers for periodontal disease, the specific ones we've identified for periodontal disease and for dental caries. We do not keep your DNA. So after the assessment is done, it is destroyed. And we do not have access to anything else going forward, other than if you had the markers for those two conditions. So there is no other information that can ever be accessed with your DNA.
Suzanne, let me run another one from one of our own evaluators, great guy, Ben Alvarez. Ben asked, for each time you run a test, you have to load it into the clinic profile and have the patient register as well. I know the answer, but I'll let you answer it.
So each test is unique. So yes, you will need to enter each test, add a patient into the system, and then the patient will need to verify. However, if you have a family, we have set it up for pediatrics. So if there are any pediatric dentists out there thinking about your pediatric population, a parent is the one who will be consenting, and they may have more than one child. They only need one profile. There is a way, I'm not going to do it here, but feel free to contact me. There is a way that you can add multiple children to one profile.
Then Mark asked that his return envelope says UPS and not Purolator. So what goes on with that? Any idea?
That is a good question. There is a possibility that our fulfillment center chose an American company to return. Please use the return company that is on your return prepaid package.
The one mine says UPS 2. So
Okay.
for everybody out there, though, let me tell you our first mistake we made in our office. We did the swipe, put it in the package, then went to register the patient, but we didn't have the barcode. So you want to seal this after you do, you want to put the barcode in, you want to do everything. My advice is you want to do the barcode and load before you actually do the swipe. You would agree, Suzanne, wouldn't you?
I do agree, yes.
Yeah. Okay. So Gavin, you asked, how do we bill for this? And is there a range? I'm going to give you my answer and then I'll let Suzanne correct me. So first off, on our first webinar, that if you take it, you get another CE credit. There are codes that are given, and there are specific codes for laboratory testing versus in-office testing. So there is a laboratory code for this. Whether insurance at this point will take it, I can't tell you, Gavin. But what I can tell you that what is the price that this will be sold to doctors for in the US marketplace, Suzanne?
So in the US marketplace, our wholesale price is $159. We are offering a promotion, if I'm allowed to say it now, there is a slide, for $120 for those of you on this evening. But that is our market price.
So Gavin, back to your point. It depends your practice philosophy. Obviously, in our practice, when we do these swabs, my assistant does everything. She loads the patient in the computer. She just does everything. I'm already out of the room. So whether you want to charge $200, $250, that's really up to you. But you can obviously see this test it's a 1-minute test, and then you're just opening up the portal. And that's what I would tell you. So again, yes, you may have to do a little teledentistry or call the patient up with the results. But again, I would tell you the amount of chair time is minimal. So that's up to you what you want to charge the patient. I just want to see Suzanne. And Suzanne, let me ask you, because I know you're more Canadian, and I know Catapult is in the middle of finalizing our review. What have you seen as the pricing in Canada? And I know the Canadian dollar is quite different than the US dollar.
Yeah, so the price in Canada is $200. $199 is what we are selling it for in Canada. So we are looking at, around $250 probably is where the dentist will be selling it at.
And I think it's important for everybody to know this is a one-time only test. Patients aren't going to be coming in and you're going to be doing this routinely. There are saliva tests that you do in office. This is a DNA test that's a one and done DNA test. Suzanne, let me ask you a question for the group. I know this is a polygenic scoring system, but if someone comes in and they come back high risk for perio, what would you say is the overall sensitivity that this patient is truly going to be really high risk at developing periodontal disease? I've seen 95% sensitivity. Do you have more that you can elaborate about the biomarkers?
That is a great Dr. Moore question, I'll be honest with you, Dr. Graham.
Okay.
And anybody who has specific science questions, please contact me and I can help to coordinate your ability to speak with our head geneticist and chief science officer. But I would defer to him on that answer.
I did see in the literature about a 95% sensitivity, which would be obviously a range that would be fantastic. I know this compares to other, obviously people that's the data points, but it would always be nice to know the sensitivity. So Leah asked, do you recommend a certain company to test saliva and bacteria to go along with the genetic testing? So Leah, that's the $1 million question. So let me tell you that the reason I love that question is that this gives you the basis of how you want to go about treating the patient. Ongoing, that becomes more of an oral saliva test or an oral DNA test. however you want to look at this. So when I'm treating my perio patients and they're high risk, and I want to assess how well they're doing beyond just, obviously probing them. If I have a baseline of an oral DNA test for their bacteria, and then I want to retest them, there are many excellent oral DNA tests out there. As far as saliva testing, we are starting to work with Oral Genome, and they test for a variety of things, including saliva buffering, pH, PG, MMPs. So again, if someone's at risk, and now let's just say you've got 5 or 7 or 8 bleeding points, and you do a saliva test and they come back low PG, low MMP, now you've got them under control, versus if they come back high, then obviously even those 6 or 7 points, you're going to want to evaluate further. And I would say, Leah, to your point, this is all about creating new protocols. And this is a whole new world out there of how we can develop this all together. So that's why I'm really excited, because I go back to explorers and periodontal probes and x-rays are really age-old diagnostics, and this is the whole new era. Okay. Let me see if there's anything else, and then I'll let everybody go and watch the final game tonight. What if we were already doing all the high-risk treatment? Now we have test info. How does that change the outcome? So let me read that one more time so I can understand. What if we're already doing all the high-risk treatment? Now we have the test info. How does that change the outcome? Well, Tania, that's great if you're doing all the high-risk treatment. But I will again tell you this, whether what you're doing is all in, you can't just do all in on every patient. So I think it's great that you're all in on a patient who's come to you with symptoms. I think if a patient is genetically at risk, it also gives that patient the information that they're not going to want to miss an every 3 or 4 month 4910 at your office, or you may be doing more transillumination, fluorescence on top of x-rays just to see early changes for caries. So I would tell you, as an office, we continue to add more and more diagnostics that I consider are, more sensitive, more specific, and I think that's where we're all going. So I think if you're already doing that, kudos to you. I think that's great. But I think patients will be more motivated if they know they're high risk. If they're low risk, then you don't have to throw everything at them. Then a lot of things we can control with the basics of oral hygiene and, obviously routine diagnostics. That's how I would look at it. Okay.